Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast. Today, my name is Terry Fletcher. So I know that last week I mentioned I was going to do a segment on pre-ops, and I'm actually saving that for next week because I was on hashtag Terry Tuesday, the compliance guy, with Sean Weiss this week, and we talked about it, so you can actually go find that segment. And I'm going to talk about it next week also on the Codecast. But something came to my attention this week several times, and I really wanted to kind of address it because it's been a hot topic lately, and it's creeping back up as far as topics that are important and to make sure you stay in compliance and you don't go crazy with coding something that you maybe didn't know wasn't codable. And I know a lot of physicians are jumping on certain added value services and thinking, oh, I can bill it for anybody. And it doesn't work that way with everything. Remember, there are codes in the CPT book that may not be covered or only have limited coverage based on the diagnoses that are allowed for certain things. And so I want to thank Sheris Lee. She was very kind and sent me an email and just said, hey, Terry, love your podcast. And it's come at a very timely point in my career. And she said she's never missed an episode. That's a lot of episodes. We're over 300 episodes now. So I really appreciate that over the last 5.5 years. But one thing she'd asked, she says, I wonder if you would ever consider doing your podcast on compliance for registered dietitian space. And I'm going to include nutritionists in this space as well, because it is a rapidly growing group of practitioners. There's not a lot of guidance, and especially post-PHE. And a lot of individual large groups, also some single practitioners, they tend to be billing for services of medical nutritional therapy or even trying E&M codes along with behavioral health services and not understanding what is compliant billing practices, appropriate documentation, and also if you're doing it via telehealth, you have to make sure that it's appropriate or it's on the list. And I'm talking about Medicare, and you have to find out what is appropriate for commercial plans. But remember, a nutritionist or a registered dietitian, an RD, they are not considered qualified healthcare providers. So when you look at CPT and it says QHPs, that's not them. So they have very limited services on what they can code or bill for. So let's take a look at what that possibly could be. And a couple of my Coding Corner members also sent me some questions. So thank you to BSW Health, Caroline. We were talking about this week as well. So it was very timely to ask to cover this in the podcast. So the first question that was brought to me was the patient has been prescribed bariatric surgery for potential weight loss, and the physician has requested they complete a rigorous prep program with a registered dietitian prior to the surgery. What would be the most appropriate code for billing those cases conducted by the registered dietitian? So what do those classes include? Let's take a look. I think you might be surprised at the list because some of it looks like activities of daily living, but they actually include introduction class to weight loss surgery, a nutrition consult, diet monitoring, learning assessments, label reading, eating out, protein drinks, and supplements. So let's look at the coding. You've got 87802 and 87803 and 87804. So the first one is the initial assessment with the patient, 15 minutes, and that's individual. Then the 87803 is a reassessment face-to-face with the patient, each 15 minutes, and again, individual. Then there's some medical nutritional therapy group, 2 or more individuals, 30 minutes, 87804. Then we've got some S codes, which are just for your MIPS, your PQRI. They're just informational. The S9449 weight management classes, non-physician provider per session, exercise classes, non-physician provider per session, and then nutrition classes, non-physician provider per session, S9451, S9452. Now remember, these are the codes, but we have to talk about coverages. So even though the codes exist in the CPT book, it doesn't necessarily mean that it's payable. And I think people miss that point sometimes. So the other question was, additionally, are nutritional visits after the bariatric surgery, are they billable by the RD or are they included in the postoperative period? And there is a Medicare LCD on this talking about postoperative care, and it talks about it for dietary issues, include vitamins, minerals, nutritional supplementation, exercise, lifestyle changes, etc. It says this has to be reinforced by counseling or support groups or supervised by the physician, and this is part of the long-term care. So this is part of that 3 follow-up visits with the bariatric surgery team within the first year. There's global considerations also. So are these billable? Well, this is the first thing I had to send to that question, and it was interesting because some people aren't aware of this, and this was on a Medicare FAQ sheet when it comes to medical nutritional therapy, and it talks about when a dietitian or nutritionist sees a patient. So their services are not necessarily covered for obesity or any kind of bariatric surgery add-on. Is it necessary? Probably, absolutely. That's a physician's call. But as far as insurance coverage, it's not necessarily covered. And we really have to talk about that because we see so much of this billed incorrectly. And then I get questions saying, well, can I bill it as an office visit? Oh my gosh. No, 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 no. I've had 2 clients in the past 20 years that have tried to bill medical nutritional therapy under the nurse visit, because again, remember, this is not a qualified healthcare provider, and they're trying to bill it incident to the physician, and Medicare took all the money back both times. They said, no, we told you that there are, services that are covered, and that's not one of them. And so you have to be, if on certain conditions or for that obesity or prior to the bariatric surgery. And again, the only way that it really helps as far as from a standpoint of a non-diabetic patient or non-chronic kidney disease patient is in your bonuses when it comes to MIPS, MACRA, quality payments. So let's take a look further at this. And you really want to make sure that you always do your due diligence before you start charging for any new service at all, because you just never know what the actual coverages are. And it's not just Medicare, but Medicare does have most of it in black and white so you can actually see it. So here is my response to the question. So you have to check with individual commercial plans and what they'll cover. But Medicare is clear for obesity. They will cover screening, 1, and then up to 2 behavioral health visits if qualified, and there's some rules on that. But the medical nutritional therapy is only for chronic kidney disease or diabetic patients. So when a dietitian or nutritionist sees a patient for their services, they're not covered for bariatric patients. Again, it's nice to have, but patients would most likely have to pay for it themselves. Now, the follow-up question was, is it not covered as medical nutritional therapy due to the nature of service? Not related to the treatment. And again, there are certain LCDs and national coverage determinations for codes in the CPT book that allow the codes to be reimbursed, but only for a certain diagnosis. For those cardiology coders out there, think about this. You do a heart cath for, let's say, shortness of breath and angina, and during that heart cath, the doctor does an abdominal aortogram, where shortness of breath and angina aren't going to pay for that. You would have to have some kind of aortic insufficiency or uncontrolled hypertension or renal disease to be able to get that paid. If you report it with, the diagnosis for the heart, it's going to be denied. Very similar very similar concept here is that the services may be covered, but they may not be covered for the diagnosis of the patient, or there may be a diagnosis link that's very minimal in what they'll actually cover. And again, registered dietitians, they are tied to the diagnosis that is under the policies for the payer. If it's routine, or if it's something, again, for weight loss and diet and things like that, as much as that's a value-added service, it's lifestyle medicine for most payers. And so it's not always something that is going to be reimbursed. And so just to clarify and kind of wrap this up a little bit, so MNT for bariatric surgery. When a dietitian or nutritionist sees a patient, they're not covered for most bariatric patients. Again, nice to have, but most likely patients would have to pay for it itself. Aetna says member has attempted weight loss in the past without successful long-term weight reduction, and the member has participated in an intensive multi-component behavioral intervention designed to help participants achieve or maintain weight loss through a combination of dietary changes and increased physical activity. But then they talk about what the criteria has to be for that. And so they talk about members' participation in an intensive multi-component behavioral intervention must be documented in the medical record. It has to show a summary letter. It has to show that medical records show an assessment of the member's progress through the course of the nutrition and exercise program. And for members who participate in this behavioral intervention, they have to show they're on Weight Watchers or Medifast or some kind of, I'm assuming, commercial diet program. And they have to have records documenting these programs. And again, progress has to be in there. They talk about the behavioral intervention could be in person or remote, and maybe group or individual based, and must be intensive. So they say that 12 or more sessions on separate dates over any duration of time, and it has to occur within 2 years prior to surgery. So that's Aetna. So I saw one for United Healthcare. They talk about it, and they basically say we'll pay for screening for obesity, and we'll pay for behavioral health, and we'll pay for one medical nutritional therapy based on a patient who actually has a BMI of over 45 and who has morbid obesity, and they have to be over 75 pounds overweight. So you have to really check your commercial payer policies, but be very clear on Medicare. It has to be tied to chronic kidney disease or diabetes. And the diabetes has to be type 2, so it would have to potentially be insulin dependent or medicine dependent. And it's really something that you want to consider. So the kind of the lesson here is that if it is a service that you can find with a CPT book, or with a CPT code, I should say, it's not necessarily covered. It is recognized. And then it's up to you to do your due diligence to figure out if that coverage is appropriate for those codes. So, and then the other thing, and this is something that's really important, the question was, can I go ahead and bill it a 99211, a nurse visit under the physician? No, no, and no. I mentioned it before. If I didn't mention it before, I'm doing it again, so I'm repeating myself here a little bit. But you can get in so much trouble for trying to bill an E&M service when another code exists. Remember, what the dietitian or the nutritionist is doing is they're doing medical nutritional therapy. They're doing counseling, and those codes exist. They just may not be reimbursed, and you can't find a code just to get it paid. I had a recent Coding Corner client member, and if she's listening to me today, she knows who she is. I'm sorry, but I have to put it out there. So she was asking about billing a subcutaneous pacemaker, and those are still under clinical trials. And so she said, well, can I just bill it as a regular pacemaker so that I can get it paid? Oh, no, 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 no. Remember, we cannot manipulate the CPT coding for payment. The very first area or very first definition of how to code for CPT, and if you're a coder, you know this, it says do not approximate a code. If a code exists, you have to use that in lieu of using a code that it just comes close. Or you have to use unlisted. And if you have a code, then unlisted would not be appropriate. So I hope this helped everyone, not just with the coding, but understanding the services when it comes to registered dietitians and to nutritionists, because I think their services are definitely needed, in primary care setting, general surgery, bariatric setting. But again, it's more lifestyle medicine according to the payers. And so do your due diligence. You know what Medicare says now, and make sure that you check on what the commercial plans say. So everyone, that's it for me today. Make it a great day, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.